Hi everyone, it's me Dr. Ikra and you are watching Med Corner. This channel is going to be all about the medical information and medical knowledge in 3D models. If you find my videos informative for you and helpful for you, then give it a thumbs up and subscribe to the channel to know more about the upcoming lectures in detail. So today we will discuss the skull bones in detail. So let's get started. Okay, as you know, the skull is just like a baseball. Skull has 28 bones. It is further divided into two groups. 14 bones are included in brain box and the other 14 are included in the facial skeleton. We are going to memorize these bones at the end of our lecture with a very funny mnemonic. So stay tuned and watch the video till the end. So let's begin our today's lecture. Here you can see the 3D model of the skull. This is the anterior view of the skull, this is the lateral view of the skull, and this is the posterior and superior view of the skull. So here we have the first bone, which is frontal bone. Frontal bone is also known as os frontal. Here you can see in the green marking, we have the frontal bone. Frontal bone is a large flat bone. It forms the anterior superior aspect of the cranium. It actually forms the forehead and it lies superior to the nasal bone, zygomatic bone, sphenoid bone and the maxillary bone. And this bone is supplied by the middle meningeal artery. Next to the frontal bone, we have the parietal bone. In this green marking, you can see this large parietal bone. This parietal bone is lie posterior to the frontal bone and superior to the occipital bone or anterior to the occipital bone. It basically has two partitions with right parietal bone and the left parietal bone. And they form the superior aspect of the cranium, and it is also supplied by the middle meningeal artery. Near to the parietal bone, we have temporal bone. In this shadowing, you can see temporal bone is an irregular bone. Temporal bone is also involved in middle and the inner ear. So this irregular bone is inferior to the parietal and the frontal bone and anterior to the occipital bone, posterior to the zygomatic and mandible bone. This temporal bone is supplied by the middle meningeal artery, auricular and mandibular artery. Next to the temporal bone, we have the sphenoid bone. Sphenoid bone is an irregular bone. It lies at the back of the orbit. Frontal bone, this is the parietal bone and here is the sphenoid bone, and it lies inferior to the frontal and the parietal bone. It lies anterior to the temporal bone. Here is the temporal bone and here is sphenoid bone. You can easily see that it lies anterior to the temporal bone and posterior to the nasal zygomatic bone. Sphenoid bone is basically supplied by the middle meningeal artery and the internal carotid artery. So next to the sphenoid bone, we have the ethmoid bone. Ethmoid bone is like a strainer because it has small holes within its structure, which allows the transverse of the olfactory nerve. As you know, the olfactory nerve is carrying the sense of smell. So this is actually along the passageway of the olfactory nerve. Other than the ethmoid bone, we have another bone. This bone is known as zygomatic bone. This zygomatic bone is an irregular bone. It's actually involved in the framework structure of our cheeks, as it covers the area of the cheeks and the area at the side of the nose, as you can see in this 3D model. Zygomatic bone is inferior to the frontal bone, anterior to the temporal bone, and lie anterior to the sphenoid bone, and lie lateral to the nasal bone. So zygomatic bone is basically involved in the structure of the face, and it is the bone that involved in our smiling. So these are all the bones of the skull which we can see from the anterior side of the structure of the skull. We study the bones of the skull from the superior aspect of the skull, frontal bone and the parietal bone, and I will also show them how these bones look like from inside of the skull. So have a look. Here this green marking shows the frontal bone, and this second green marking at the back of the frontal bone we have the parietal bone. We have right parietal bone and the left parietal bone. So far we have seen the bones of the skull from the anterior view, inside of the cranium, and now we are looking at the inferior view. When we see the bones of the skull from the inferior view, we have some prominent bones. Here you can see in this 3D model. Here the first bone in the inferior view we have is this maxillary bone. Maxillary bone is actually forming the upper jaw, and it covers anterior aspect of the cranium. As you can see, it's a large irregular bone, and it contributes to the formation of the orbit, nasal cavity, hard palate, and the viscerocranium. Each maxillary bone consists of the maxillary sinuses. Next to the maxillary bone, we have this palatine bone. Palatine bone is basically an L-shaped bone. As you can see in this model, it's an irregular bone, and it's basically L-shaped bone found posterior to the nasal cavity, and it's supplied by the palatine artery. Next to the palatine bone, we have the vomer. Vomer is a small bone. It's a flat bone, and it is basically providing the connection between the right and the left nasal cavity. It's forming the septum of your nasal cavity, and this bone is supplied by the sphenopalatine artery. So here is the final view of the bones of the cranium. So now we are going to see the bones of the cranial cavity from the internal side of the cranium, neurocranium. We will go from posterior to the anterior side. So here we have, in this green marking, we have a bone covering the posterior inferior part of the neurocranium, which is occipital bone. This occipital bone consists of the large opening. This is known as foramen magnum, and this foramen magnum is allowing the transverse of the vertebral artery, which is going to supply our occipital and the posterior aspect of the brain. Near to the occipital bone, we have temporal bone, as we already discussed about the temporal bone. Next to the temporal bone, we have the parietal bone. Parietal bone are basically divided into two, right and the left parietal bone. Anterior to the parietal bone, we have this wing-like bone is known as sphenoid bone. Anterior to the sphenoid bone, we have the frontal bone, which actually forms our forehead. So at the last, we have this stair-like bone. This is known as ethmoid bone. Ethmoid bone and this small opening is known as cribriform foramina, and these small openings allows the transverse of the olfactory nerve, which carry the sense of smell. So this was all about the today's lecture. I hope you will get the better understanding of the bones of the skull from all the views. So at the end, we are just going to memorize all the bones quickly with a very funny mnemonic. So here we have the mnemonic: spin every front object toward party. So this was all about the 8 bones which we divided from the brain box into 2 parts. Other 6 bones forming the neurocranium are also the part of middle ear. So here we have the mnemonic MIS, miss. M for Malleus, I Incus, S Stapes. So here we have the mnemonic for the last 14 viscerocranial bones. My zebra likes New International Pizza very much. That's all for today. Thank you so much for watching.